Hello, I'm Alfonso Severos from Second Saturday. Right now you are watching Health and Wellness with Rose Ann Green.
They can't keep doing the same things over and over again and expect a different result. And we have to have clear thinking, so we have to have the nerves flowing properly. So the spine is very important. So the spine needs to be corrected.
I was in a tragic accident, and the x-ray and the MRIs from that accident detected that I was in stage 3 Hodgkin's lymphoma, which is a form of blood cancer.
I always say that first because food is first, but it actually is the patient, the doctor, and the nutritionist working together as a team.
Certainly, I do recommend a holistic approach. I think generally, globally, that's where the world is heading. We have to remember who we are.
Welcome to another episode of Health and Wellness. I'm your host, Dr. Rose Ann Green, and today is a two-part series, and with me is a special guest, a very special guest. Joining me today is Dr. Philippe Douyon, who is a compassionate and dynamic board-certified neurologist, and he's also the founder and CEO of the Inlay Brain Fit Institute and the creator of the app, Dr. Douyon's Brain Fit. Welcome to the program.
Thank you for having me.
It's a pleasure to have you on the show.
Thank you.
I have been stalking your page, as they would say, but I've been researching on you ever since I found out about you on Instagram. And what is so unique about you is that you approach medicine with an holistic, you have a holistic approach when it comes to medicine, not just medicine, but it has to do with the health and wellness side of it. So for our viewers who don't know who Dr. Douyon is, give us a little bit more background as it relates to what else do you do?
Sure. So I'm a neurologist, like you said. I've spent the last 6 years as an epilepsy specialist. Mm-hmm. And in that time, what I found is there are so many different things that influence somebody's health. Mm-hmm. It is the stressors going on in their life. It's the food that they put into their body. It's their level of activity. It is their experience of past trauma. Mm-hmm. And it's hard to help somebody truly heal if you're not addressing all of those issues. Mm-hmm. And so for me, the biggest impact I've always had on my patients isn't when I prescribed medication or took them to the operating room. Right. It was when I got them to think very differently about their life and their health. Right. And so I wanted to turn that into a different kind of approach to medicine. And so for that reason, I started the Inlay Brain Fit Institute, where we create individualized exercise programs for people based on their medical and neurological needs. Wow. Because exercise is one of those things, it's not just good for your body, but it's good for your brain. And it's the biggest promoter of neuroplasticity there is. And that's the brain's ability to adapt, learn, heal, make new neurons. And so we use exercise in that way.
Right. Starting out in medicine, when you started out actually in medicine, did you started with this approach, or it becomes something that you actually look into after started in medicine? Yeah,
so I think as an MD, we're taught about medicine in a very particular way. We're taught about disease, and we're taught about medications that help those diseases. And as you sort of get going in your career, you start figuring out what helps your patients the most. You start figuring out how it is that you can impact people's lives. And you sort of become, you break out of the mold of the doctor that they try to get you to be. And become sort of the best doctor that you can be for the people that you serve.
Right. Wow. You spoke about epilepsy and in terms of looking at it, and I see in your bio, which is a very extensive bio, that you focused at one point on epilepsy and the impact of it. Talk to us about the inspiration behind choosing to look at that specific illness.
Yeah, so a lot of people are not quite sure what epilepsy is. So when somebody has a seizure, that's because there's a misfire in your brain. All of our brains, the way that the cells communicate is through electricity. And so when somebody has a seizure, there's a burst of abnormal electrical activity in their brain, almost like a short circuit. Epilepsy is somebody who's at risk for having multiple seizures.
Right.
And we always say that so many different things can cause a seizure, whether it is head trauma, some electrolyte abnormalities, that everybody's entitled to one in their life.
Wow.
But if you're at risk for having more than one seizure, then that gives you a diagnosis of
Right.
epilepsy. And I've seen people who have had epilepsy their entire lives.
Wow.
Some of them well controlled with medication, some of them not.
Okay.
Some of them who have done incredibly well with diet and exercise.
Right.
Some of them who have done really well with surgery.
Right.
And so you really have to look at all the factors contributing to the reason that somebody has epilepsy
Right.
in order to really help them just kind of live the life that they want to live.
Right.
Right? Even if it might not be a cure for that particular person, because the goal for everybody is going to be different.
Right.
If somebody has 100 seizures a month, you can significantly improve their life by cutting
Right.
it down to 10. Or if somebody has one seizure a year, maybe a more realistic goal is to get them to a place that they're seizure-free.
Right.
But a lot of things impact somebody's epilepsy.
How do you approach, in terms of the treatment process, how do you approach it? What would be your recommendation in terms of how to approach the treatment? What exactly, because you were talking about in terms of not just the medicine side of it, but also in terms of diet and everything and exercise, how do you approach it personally?
So the first thing you want to know is why that person's having seizures. Right? So you want to try to figure that out. And then you want to figure out where in the brain the seizures are coming from.
Right.
Some people will get a misfire in their entire brain all at the same time. And those are the people that tend to fall to the floor and have these big convulsions that we think of when
Right,
somebody
right.
has seizures. Some people, it'll just be one particular area of their brain that sort of misfire and causes a seizure.
Okay.
And their seizures could look like anything, depending
Right.
on the part of the brain that's involved. And so you want to know why they have seizures, where it's coming from,
Right.
because that's going to help guide you in terms of the best treatment option.
Right.
But I've had somebody who has had lifelong seizures.
Right.
She's had epilepsy surgery. She's been on every medication that we have.
Right.
And hasn't done well.
Oh.
And I got her to a place that she was seizure-free for 6
Wow.
months just by taking soda out of her diet.
Are you serious?
So what we put into our bodies has
Wow.
a huge impact.
Right.
Wow. And this particular person then started coming back to the emergency room with seizures. And so, I asked her, I was like, what's going on? And she was like, well, you're not going to take soda out of my diet again.
Wow.
Right. So what we put into our bodies has a huge impact.
Right.
And what we think about what we put into our bodies also has a huge impact.
Right. Do you find in your practice that even persons who are extremely overweight sometimes suffer from seizure, or that's not a contributing factor to seizure?
Well, we know that living a sedentary lifestyle has a really negative impact on our brains.
Right.
And if you look at the trends in the last 30 years in terms of the diseases that have gone up,
Right.
it is obesity, it is diabetes,
Right.
and it is Alzheimer's disease. Right. So there's a link between those three things.
Right.
And so it's always really important for us to really invest in ourselves, do the things that we can do to take really good care of ourselves and get as fit as possible.
Right. Wow. And also, because I heard of persons, they say, oh, I'm extremely stressed. I suffer a major loss in my life. And after that, I started suffering from mental illness or seizure. So on a broader spectrum outside of epilepsy, can stress causes certain neurological disorder in the body?
Yeah, so stress is really bad for the brain. And stress can actually kill brain cells, can kill neurons.
Wow.
So oftentimes I'll give an example of if a lion comes into a room, that's going to freak people out.
Right.
They're going to be under a significant amount of stress in that moment. Their body's going to secrete large amounts of cortisol and adrenaline to try to figure out the best way to overcome that threat.
Right.
If we survive that lion attack, 2 weeks from now, we could be telling this story to friends and family, and they say to us, well, what were you doing in that room? And we may not remember. Because cortisol kills neurons, especially in the parts of the brain responsible for memory.
Wow. Wow.
And so it wants you to focus on the immediate threat and sort of blocks out the other memories that you
Right.
could potentially make.
Wow.
And if you take that example and apply it to people who are under chronic stress, whether it's their current lifestyle,
Right.
whether it's past traumas,
Right.
oftentimes
Wow.
those people will have memory problems.
Wow. Wow. I'm sure a lot of our viewers didn't know that piece of information, but also in terms of different things that persons are doing that are wrong. Because I heard some of my fans or some of my friends would say, well, I'm not overweight and I'm walking to the train every day. and I'm by the look of things, they're healthy, but they're not working out.
Right.
What would you say to those persons that it relates to being healthy or being in a state that they should be mentally well?
Yeah, I would say for our brains and our bodies to perform at peak performance, our bodies need to work hard. We need to be exercising in a way that challenges us.
Right.
We need to constantly be learning. Those things are crucial. And our bodies were designed for us to move, to run, to jump, to perform all kinds of different movements.
Right.
And at the helm of that ability is our brain and our spinal
Right.
cord. And so those things are really, really important. We could see significant changes in somebody's
Right.
brain who exercises on a regular basis. That'll look very different than the person who doesn't exercise at all.
That's for sure.
For a whole host of reasons.
Right.
Exercise will minimize your risk of preventable chronic diseases
Right.
like high blood pressure, diabetes, high cholesterol.
Right.
Those things that have a significant negative impact
Right.
on the brain. And like I said before, exercise gives your brain everything that it needs to make new neurons and new connections.
Right.
It is also the best anti-anxiety treatment there is, the best
for
antidepressant
sure.
treatment that there is.
That's for sure.
So exercise is crucial for all facets of our
Right.
life. And it's not just the aesthetics of how we look, although we want to look as fit as possible.
Right.
But it's all the health benefits.
Right. Let's touch a little bit about, because you're the founder and CEO of the Inlay, because I want to pronounce it correctly, the Inlay Brain Fit Institute. Talk about in terms of how you approach your clients when they come to you, and if you address them as clients or patients, how you tailored the program for each specific client, how it works coming to
Yeah, so I think about them now as clients because I'm not treating their medical problems the way that typical doctors do.
Right.
I'm not prescribing their medications. What I'm doing is I'm oftentimes getting a summary of their medical history,
Right.
any symptoms that they may have,
Right.
any deficits in terms of what they're able to do physically, talking to them about what their goals are,
Right.
and based on that, coming up with a plan that's going to work for them.
Right.
And that plan is usually something that's anywhere from 25 to 30 minutes, 3 or 4 times a week.
Oh.
Doesn't include any equipment. It's things that they can do at home in their
Right.
backyard, on their block.
Yeah.
So we're trying to remove some of the obstacles that prevent people from exercising.
Okay.
And oftentimes, if you ask somebody, well, what kind of exercise should you be doing? Most people will tell you, I don't know. Right? I'll go run on the treadmill.
Yeah.
I'll lift
For
some
an hour.
weights and hope that I don't hurt myself.
Exactly.
Right?
Exactly.
So those things can be barriers to getting somebody to move.
Okay.
And exercise doesn't have to be going to the gym. As long as you get your body moving at a pretty moderate intensity, get your heart rate up,
Right.
get yourself sweating, that tends to be really, really great. And so,
I'm sure my viewers want to hear that again.
yeah, and
You don't have to go to the gym.
you don't have to go to the gym. So if you're somebody who loves dancing, find a way to dance 3 or 4 times a week. Right?
Okay.
Because that's going to get your body moving. That's going to get your heart rate up. That's going to get you sweating. That's going to
Okay.
give you all the benefits that traditional exercise will give
Okay.
you.
Okay.
Swimming is great if you have access to a pool.
Yeah.
Picking up a new sport or playing sports
Right.
is really great. I sort of grew up in an era where people used to always talk about the dumb jock, right? And I don't think that's actually true.
Explain.
Besides all the analysis that athletes need to do when they're competing, but the level of exercise that they're engaging in gives their brain everything the brain needs to learn as efficiently as possible.
Right.
And so I grew up playing and competing in tennis, so I'm biased towards tennis, right? But when you look at somebody like Serena Williams, if Serena Williams wins a tournament in Italy, she delivers her victory speech in Italian.
Right.
If the next week she wins a tournament in France, she delivers her victory speech in French.
Right.
Her bio says that she knows Spanish, and obviously she is fluent in English.
Right.
And a lot of tennis players are polyglots. They know multiple languages. And yet they never spend more than a few weeks or a month in any particular
That's
country.
true.
Right? But because they're constantly moving their bodies, their brains are able to learn very efficiently.
Wow. Interestingly,
You know,
looking at it, wow.
and we also think about kids, right? They always talk about, oh, kids have the capacity to learn so much,
Right.
right? Which is true. But what's the one thing that kids do that adults don't? Kids are constantly moving.
Always.
All the time.
Always.
Constantly running. They're constantly exercising.
Okay.
Giving their brains everything their brain needs to learn.
So for persons who, I know some persons are asking right now, so I'm going to ask. For persons, they're saying, what physical exercise has to do with the brain? What if I just stay home, do a puzzle on my computer or on my iPad and just keep working the brain? Wouldn't that be enough for the brain? Or I need to move the entire body to help the brain?
Yeah, so you need to move the entire body.
Okay.
And you need to move the entire body because when you do that, that causes your body to release certain chemicals that promotes the formation and creation of new
Right.
neurons and new connections. It causes the body to release certain chemicals that promotes the formation of
Right.
new blood vessels that sends blood to the brain, but as well as throughout the entire body.
Right.
It minimizes your stress, so it minimizes chemicals like cortisol and
Right.
adrenaline that are going to have a negative impact
Right.
on the health of your neurons.
Right.
So it's really important to move your entire body. But it's also really important to challenge yourself
Yeah.
from a mental perspective, from an intellectual perspective.
Okay.
So picking up new hobbies, right? Learning new games,
Right.
reading, writing.
Right.
Those things are incredibly important. Having conversations with people
Right.
who think differently from you, who don't share your perspective. right?
Exactly.
That's really important. You don't have to agree with them,
Right.
but their perspective is invaluable. It allows
Right.
you to make new connections that maybe you hadn't thought about before.
Wow. Interesting way of looking at it. Also, as we talking about in terms of playing stuff on our phone, you're the creator of the app, Dr. Doyon's Brain Fit. Talk to us about it because I have it, I have it on my phone and I got addicted to it. Not just the matching of three, but it's very unique. It's unique in the sense that it's not just trying to match colors together,
Right.
but the things that you chose to put in the game.
That's right. Yeah.
Plus the questions. Just talk to us about it, break it down for us, and tell us about the app itself.
Yeah, so first of all, I don't want anybody getting addicted to the game.
It's a good addiction.
But yeah, I wanted to create a game that got out the message that there are things that we can do every day to keep our bodies and brains healthy.
Right.
And that is exercising, what we're putting into our bodies, minimizing stress.
Right.
And I wanted it to have an impact on both the conscious mind of the person as well
Right.
as the unconscious mind.
Right.
And so the way that the game has been designed is that you're matching at least 3 in a row of healthy foods and healthy activities.
That's true.
Right? And so that way on a subconscious level that person is making that connection.
Right.
And so the game has 40 levels. Each level represents a different disease state. So level 1 starts off with sedentary lifestyle.
Yeah.
You move to things like high blood pressure, diabetes, what we think of then as primary neurological disorders.
Right.
And level 40 is Alzheimer's disease. And so as you're moving through the levels and making these matches, every 6 or 7 matches or so, there are questions that come
Yeah.
up related to that particular level, that
Right.
particular disease state. And so that way people are learning consciously
Right.
while they're also playing the game.
Yeah.
And it's all holistic intensely focused. I don't talk about medication. I don't
You
talk
don't.
about surgery.
You don't.
It's really about those things that you can do on your own every day
Right.
to keep your body and your brain healthy.
Right. It's very interesting because I used to watch playing Candy Crush. I love puzzles because, and in terms of word games, because it challenges me to learn more. And then I wasn't necessarily optimistic of like, okay, it's a matching game. But when I got into it, I'm like, oh no, it's not just a matching game. It's a game with questions, and I'm learning, and I'm like, ooh, interesting. I hope and I pray that others may be inspired by what you are doing with these things, especially because you're true to your craft, you're true to what you do as a neurologist, because all these things has its connections, and from the company to the app, and now your book. Talk to us a little bit about the title. Why did you choose this title?
Sure. So the title of the book is Neuroplasticity, Your Brain's Superpower. And so for a really long time, we used to think that our brains did not change, that the only change that we would see is maybe as we get older, there's some kind of degenerative process that
Right.
causes neurons to die and the brain to shrink. Maybe some trauma causes some structural changes in the brain.
Right.
But in the last couple of decades, we've realized that the brain is constantly changing. Everything we do has a significant impact
Right.
on our brains. Every conversation we engage in, every thought we have, every action that
Right.
we take. And for me, that is an empowering
Right.
perspective because it lets us know that if we can change our brains, we can change our life. It lets us know that if we're dealing with some neurological issue, there are things that we can do on our own that will help our brains reorganize itself, help our brains make new neurons, help our brains heal and improve.
Right.
And so for me, that ability
Your
to
brain's
create
superpower.
new neurons and
Yeah.
new connections is a superpower.
It is, because one of the things that I wanted to read the book for this reason, because you make the connection between the medical practitioner and the patient, and a medical practitioner can read a book and make sense of it, and the patient or the average person can read a book and make sense of it. When you're writing it, was that a main focus and drive for the book when you're putting it together?
Yeah, when I was writing it, it was so that way anybody can read it, that the person didn't have to have a certain level of medical education to read and understand
Right.
what's going on. When it comes to things that have to do with the brain, it's already a complicated issue.
It
right?
is.
And can be very intimidating for people.
Right.
And so, so I wanted to write it in a way that anybody can pick it up and be like,
Right.
oh, wow, I learned some stuff here.
What are the probably 5 takeaways that you would want person generally to take away from the book itself after reading it? Because I'm sure for persons, it's available on Amazon in the Kindle format and also paperback, so you can get it, and it's very reasonable. Yeah, it is. So what are 5 takeaways that you would want persons to take away from the book itself?
So the first would be that our brains are constantly changing, that our brains are adapting, that our brains do learn, that our
Right.
brains can heal from injury.
Right.
I often feel like
Wow.
people don't think that that's the case. They feel like their brains don't evolve
We're
in
taught
any
differently.
way. Right? So we need to unlearn what we were taught, and we need to realize that our brains are capable of a tremendous amount of change.
Right.
The second thing would be what is it that changes the brain? What actionable steps can we take on a regular basis to
Right.
keep our brains healthy?
Wow.
And so it's things like exercise and eating right,
Right.
and minimizing stress,
Right.
meditating, getting enough sleep, doing those things on a daily basis that have really beneficial impact on the brain.
Right. Wow.
The third thing I would say is that we need to be very mindful of the messages that we take in. If conversations
true.
that we have and thoughts that we have are capable of changing our brains, then we need to realize that if we're taking in a lot of negative messages, or if our self-talk is really negative, that's going to have a negative impact on our brains and therefore on our life.
Exactly.
And so we want to make sure that we surround ourselves with people that are really supportive and give us positive feedback. But more importantly, our own self-talk has to be really positive. And that's why things like affirmations are so incredibly powerful.
It is.
Right? Because it changes your brain, and obviously then can change your life in really positive ways.
Wow.
The other thing I would say, the fourth thing would be that if you know somebody who has a neurological disorder, or if you have a neurological disorder, then there are things that you can do to help your brain heal.
Right.
It doesn't mean that things are going to go back to 100% what they were before, but the brain can continue to heal days, months, years, decades after the injury, as long as you are putting in the work.
Right.
And oftentimes, I'll see when somebody suffered some neurological trauma, that they stop putting in the work. And that becomes part of the issue.
Yeah.
The fifth thing I would say is that I want people to feel empowered by the fact that their brains are capable of changing. Because if that's true, then you can certainly change your life. And if that is true, then we're not necessarily these passive pawns waiting for some degenerative change to occur. I think it lets us know that we're much more in control of our neurological destiny than we've ever thought. And to me, that's an empowering and hopeful message.
It is. It is. Well, I need to let my mom watch this episode, because I know she suffered from stroke, and we just trying to motivate her, like, you can get better, Mom, you can get better. So I really appreciate you for being on this show. We're going to have a part 2 to this episode. So this week we're going to show you this episode, and please stay tuned for part 2. But before we go, I want you to give persons your information as it relates to how they can get you to come to their conference, or to...
So you can go to my website, www.inlebrainfitinstitute.com, INLE brainfitinstitute.com, and you can send me an email through there. Or you can email me directly at my name at gmail.com. So Philippe Douyon at gmail.com. PHILIPPEDOUYON at gmail.com.
Thank you so much, Doc, for being on the show. Thank you so much for joining us. And you'll be joining us for another episode, follow-up episode. So thank you so much to our viewers for always watching Health and Wellness. As I always say, stay well.